Since we've been talking about our blood pressures, we talk about the regulation with fluid volume, we talk about the regulation of blood pressure with stroke volume, contractility. Well, in times when your blood pressure is too high, we refer to that as hypertension or high blood pressure. Now, hypertension can exist in two clinical states, and I particularly don't care much for the first terminology. Essential hypertension, I prefer to call this primary. Essential sounds like you have to have high blood pressure and you don't. But essential hypertension indicates that you have high blood pressure and there's no explanation why you have high blood pressure. You just do. In so many instances, patients are placed on the medications that can help lower their blood pressure in a general sense. But there's also situations where you have high blood pressure because of an underlying medical condition. You may have kidney disease or tumors, such as you see listed here. And if you alleviate the underlying condition, the blood pressure will resolve. And so that's how we distinguish between essential or primary hypertension and secondary. Now we realize that we have a normal diastolic and systolic of 120/80. That is our normal blood pressure. And you see that as you move into, in both our systolic and diastolic, about 20 points higher for your systolic and about 10 points higher for your diastolic. This is where you're getting into the range where you're starting to be concerned about the blood pressure. Now, if one or either of those numbers changes, that is your hypertension, or in this case, prehypertension. And the diastolic is the one that's going to change less, but be more significant. You see clinical stage 1 is up to 160 and stage 2 is over 160. But for your diastolic pressure, it's only 90 for stage 1 and 100 plus for stage 2. This is where you need to begin to seek clinical intervention. Certainly, there's a lot of pharmacologics that can help with that. Now, what causes high blood pressure? Essentially, our secondary hypertension, or in some cases, your primary. These are going to be obesity. When you put on too much weight, and many doctors will just simply tell you, you need to lose weight. And by and large, there are many medical conditions that could be made better by losing weight. Sodium sensitivity, insulin resistance, you see many of these. But then you see sleep apnea. Now, sleep apnea we're going to talk about a lot in our respiratory chapter. Sleep apnea is going to lead to a situation where your body at night, if left untreated, produces more and more adrenaline to rescue you from essentially suffocation. And that excess adrenaline left over in your system is going to keep your blood pressure higher. It's going to keep your vessels constricted, so that is a systemic response. It is a sympathetic response. And so if you can alleviate the sleep apnea, your blood pressure will resolve. So that would be a great example of a secondary type of hypertension. Fortunately, genetics. Genetics can lead to the primary type. If your parents have high blood pressure, chances that you are going to have hypertension as well probably are drastically increased. Now, with age, certainly you're going to have a reduced compliance to your vessels. And as they become more rigid, that is going to cause your blood pressure to elevate to move the blood through. We're talking about resistance, cardiac contractility. So that's just going to cause your blood pressure to creep up over time. Unfortunately, that's one of the consequences of growing older. Now, this last one is, you may think trivial. I like to include this because licorice, and I'm not necessarily talking about the Twizzlers candies. I'm talking about the real genuine licorice. And if you've ever had this bitter black substance, you'll know what I'm talking about. But while we may not snack on licorice as often as maybe happened 100, 200 years ago, licorice is a component of many types of medications, especially over-the-counter products such as cough suppressants and throat lozenges. So if you have an individual, a patient, a loved one even, that suffers from hypertension, make sure to read the labels on your medications so that you are not making one condition worse, your blood pressure, by trying to treat another condition such as peptic ulcers or having a cold and cough. Now, whether this is essential or secondary, if your hypertension is left untreated or you have persistent hypertension, your risk factors for some fatal problems are drastically increased. You're putting pressure on these vessels that might lead to strokes in your brain, a myocardial infarct, an arterial aneurysm. You could, if in some instances you had a congenital defect that made the wall of your aorta less strong or weaker, then in those situations, you could have an aortic dissection, in which case, very little chance of recovery from that. By the time you would get to the hospital, you would already be dead. So, take care of your hypertension. In fact, this statistic is very sobering. If you have a mean arterial pressure 50% above average, then not only is this shortening your life expectancy, look at this. You can expect to live for only a few more years if it is not treated. We're not talking about living only to 85. If you begin this at the age of 40, you may not make it to 45. That's how serious dealing with blood pressure is. And I think in our society, by and large, it's something that people just ignore. And they're really playing a dangerous game by leaving their blood pressure untreated. Now we're going to shift gears a little bit because that's too much pressure. That's a problem in your circulatory system. This is almost the opposite. This is hypovolemic shock. And as the name says, hypo means below, volemic volume. This is where you've had an injury and you're bleeding, severely bleeding. And so your body, in an attempt to prevent the loss of blood, to maintain your blood pressure in the face of decreased blood volume, your body is going to go into a sympathetic response. You're going to have the tachycardia. You're going to have the systemic vasoconstriction. You're going to have the activation of our systems and hormones to try to restrict the loss of your fluid in urine and retain it in your body. And when you have all of this sympathoadrenal inputs, hormonal and neuronal, it's going to result in low blood pressure. Well, you're bleeding out. Of course, your blood pressure is going to be low. Rapid pulse is going to be your sympathoadrenal tachycardia kicking in. Your heart's going to be beating faster. Cold, clammy skin that you see. Now remember, vasoconstriction to your non-vital organs, that includes the skin. So since you're not having as much blood flow to your skin, that's why it's going to feel cold. Reduced urine output, that just makes sense because you're trying to conserve every bit of fluid because you're losing so much blood. What's the solution? You have to get blood. That's it. You know, someone that's bleeding out, they feel cold. People say, oh, they're going into shock. Let's keep them warm. Yeah, you got to keep them warm, but you got to stop the bleeding. And you have to give them more fluids. You have to give them the blood transfusion. So if you are treating a victim of an accident, of an injury, make sure you or someone else calls 911. Get some first responders there as quickly as possible before you do anything else. Because as you're rendering first aid, if you're not somehow getting them closer and closer to a hospital or an EMT, an ambulance that may be able to give them some fluids and blood, you're not going to be able to do much for this person to prolong their life. Now, another bad day, hypovolemic shock, that would be a bad day. Well, congestive heart failure is another where it's going to be difficult to recover from this. And congestive heart failure leads to a lot of confusion because congestion, you usually think in your respiratory system, and here we're talking about heart. I mean, the heart's already full of blood. How can it be congested with blood? Well, what happens with your heart as it begins to fail, it's not functioning as efficiently. And this may be from ischemic heart disease. It may be because of you've had heart attacks in the past, and so the muscle isn't working. The conduction system possibly has been damaged. Or you've had some damage from high blood pressure, some sort of cardiopathology, such as a heart valve disease or heart defects even, that may be not discovered until later in life. All of these things can lead to a weakened heart becoming less and less effective. And so as the heart is pumping less blood, pumping it less efficiently, remember, we usually have that 120 millimeter mercury pressure head in our aorta. That's going to push the blood through the body and back to the heart. Well, as we have less and less blood pressure, blood's begun again to pool. We're not going to have as much venous return making its way back to the right ventricle. And we're also not going to have as much fluid returning from the lungs. And the longer the blood sits in the lungs and the capillaries of the lungs, because there's a very high density of capillaries, because remember, capillaries are our exchange vessels. We're not only going to be exchanging gases, but the longer the blood stays in the lungs, the more fluid is going to leak out into the lungs, be part of the interstitium, and that's going to be collecting in our spaces where we should have air. And that's going to prevent the gas exchange from occurring. And at first, you're going to have shortness of breath. And especially if you're laying down, it's going to pool in your lungs. But this is going to get worse and worse until essentially you suffocate, because the heart can't move the blood enough to clear the fluid from your capillaries and from your lung tissue. So in this illustration, you can see on the left, you have normal blood flow. You can see your red blood cells passing through those capillaries. You can see an illustration of our air spaces. Now, we're not going to get into the details yet. That's going to be in the next chapter. But these are the small little bubbles where gas exchange occurs by diffusion. So it's a very thin membrane. So rather than having air fairly close to our blood vessels, you see now on the right, we now fill these little air spaces called alveoli with fluid. You see the air at the top of that air fluid interface. Now you've got further for the air and the gases in the air to exchange with your red blood cells that are still down below. So that you basically are drowning in your own tissue fluids. That's the congestive heart failure, and that's where we plug the congestion in with our failing heart.